Well, welcome to U.S. Healthcare Systems. I'm Dr. Pellegrino. I'm working with Professors Brian Miller and Amanda Espenschied-Riley this semester, and we wanted to provide you your first online lecture, which is called The Future of Healthcare, and what systems will support it. We're going to be working with some key themes around globalization of healthcare, biotechnology, and where that converges with healthcare enhancement, and how we hopefully will live longer, and then what does the era of predictive health care lead us to. Since this is your new class, this is a relatively new class to the college, we want you to understand how this PowerPoint lecture fits in with your assignments for this week. So you should have read a historical document. You're going to have opened up a Word document, and you will have already created a working definition of the healthcare system. And again, you can use your book or articles or other sources. And the idea of a working definition is that you're going to work with that throughout the semester, and it may be tweaked to make it stronger. Then you will have listed as many healthcare systems that you could think of, and then as you're participating in this lecture, you're going to add more as you think about that. So you should have already then researched two articles, one on NPR and one not on NPR, with a story that corresponds with your name and healthcare system, or healthcare with a space in between it. Believe it or not, these are different. And you're going to just summarize those, and what kind of evidence did they present about the current state? Is it positive, negative, growing, shrinking, whatever the source is talking about. So we want you to get involved with the literature that's out there. Some of it's good, some of it's not so good, but we'll be exploring that throughout the semester. And so then as you're moving into the PowerPoint now, we're going to be giving you 5 prompts. Those are also listed in the LMS, and you're going to be adding those to the same Word document, and you're going to be, at the end, saving that document and submitting it to the LMS. You can drag and drop it into the box under the assignment, and you'll get a verification that you turned it in. And so it should be in, I think, before the start of class. So, all right, so we will get started around emerging healthcare drivers. So the idea of emerging is that we don't have a total picture of the impact of factors that will drive health. Health for the individual, health for a population. And those are going to be 2 big things that we talk about, individuals and populations. So all in all, when we're talking about emerging healthcare drivers, it's about futuring. What's the future going to bring to us? So we're going to hit 4 big factors in this lecture. One's the globalization of healthcare, again, the biotechnology, healthcare, and convergence, health enhancements and longevity, and an era of predictive health. Although this PowerPoint will remain active throughout the semester, we really encourage you, as a successful habit, we encourage you to take notes. This will help your brain literally build the myelin, the connections that will be tested and used throughout the semester. So yes, there will be a short quiz at the beginning of class on this and other materials that you have online. All right, so globalization. It's the process in which people, including their genes, their germs, and their habits, as well as ideas from the community, goods or materials, spread throughout the world, and they spur more interaction, and so there's a sort of a snowball effect, and that could be both good and bad as we find integration of the world's cultures, governments, and economies. So each of these is part of a formal and informal systems that promote transfer. And so sometimes it's for the good if you think of the idea of vaccines, and it's sometimes bad in terms of disease transmission. Just sort of a fact here, between 1971 and last year, we doubled the population. So we went from 3.764 billion people to 7.125 billion. So we have a lot more people, which means a lot more factors that influence our health. But during that same time, we've also increased 10 years our lifespan globally. So from 60 years to 70 years of life expectancy. So our population by 2020, as we think about the future, and that's not too distant of a future, only 3 more years, 95% of the world's 8 billion people will be living in developing nations. And developing nations are sovereign states that have a less developed industrial base and a low human development index. And the Human Development Index, the HDI, is a composite statistic. So they take different pieces that other statistics bring together and rank life expectancy, education, and per capita income to rank countries into 4 tiers. So as we're thinking about the global and how that influences us, we also have quite a bit of a diversity in the United States. So here's a map of the American Human Development Index. And you can see where states like Connecticut, way up in the Northeast, has a rating of 6.17. Now this is compared to the overall United States Human Development Index, which is 5.06. So Connecticut's a whole point above it, a little bit more than a whole point above it. But then you can go down south to see Mississippi, and they're down at 3.81, so almost 1.5 points lower on the index in Mississippi. In Ohio, we're actually not too far off the U.S. Norm, which we're at 4.71. Our education index is 4.89. We have a 77.8-year life expectancy, and our median earning in the state in 2013-14 was $27,000. So that gives you a sense that the world is not average. It doesn't have every country having the same resources. And same thing in the United States. We don't have equal resources and equal life opportunities, throughout the United States. So pay particular attention, since part of our border, or a lot of our southern border, is connected to states in that light green area, which means there's a lot more health challenges in those areas. As the world grows, it also is growing because people are getting older. So aging baby boomers are transforming our markets, and that has implications for chronic disease, as well as the sort of acute disease that happen that break out, like Zika or Ebola and things like that. So where we were, 100 years ago, as you read in the first article, where you start thinking about where we are today, things are going to continue to change based on our demographics. Part of that demographics is where people live, and so our U.S. healthcare systems are really going to be concentrated in the urban areas. So when you look at this map, it depicts the crowding of urban areas. So the countries with the darkest colors have between 75 and 100% of their population in urban environments. And then the red circles are individual cities with 10 million people or more in them. And so as we're thinking about mega cities, how do they make a difference in people's health? And then what are those systems that need to be in place to take care of people, either preventing disease or helping people recover from disease? And then in the reality, as you can see in our geopolitics, there's going to be some competition out there. And competition can also lead to violence, whether you're thinking about actual wars or it might be drugs, and it could result in things like migration. But we also have geopolitical risks in terms of resources. So as you can see, in the previous maps, developing countries are where going to be a lot of needs. And so resources like water are going to be a big piece to how we relate to each other. And having clean water is going to be an important piece. And then you can also think about resources like pharmaceuticals. And as they are limited or shared, people are going to either become more healthy or less healthy. Again, as we move to a longer lifespan, 10 years over the, since 1945, we have an opportunity to shift from a disease-centric, meaning we're trying to stop cancer, or we're going to try to stop AIDS, or we're going to try to stop acid rain. We can move to a more prevention-centric medical model. And so when we're looking at like the top 10 leading causes of death, which are heart disease, cancer, chronic lower respiratory disease, accidents or unintentional injuries, stroke, Alzheimer's, diabetes, influenza and pneumonia, kidney disease, and suicide, we are now wanting as a profession or a set of professions to think about what are the things that cause these and what can we do to go upstream to stop the problems from actually leading to these deaths. So whether it's heart disease and thinking about what kind of food do people eat or what kind of food is actually available to them, to things like suicide and having community-centered models that allow people to access help mentally. We can look at prevention. All right, so innovations are coming faster. I was just thinking, we were visiting my mom's house, and my 13-year-old daughter was playing with a crank phone. If you can imagine those in the old movies, you crank it and you talk to the operator. And it was really interesting to hear how my mom was trying to explain to my daughter that someone had to be at the other end of that phone and connected wires to somebody else who had a phone. So sort of to my delight, my daughter asked if that person's name was Siri. And although my mom chuckled, and she doesn't use Siri, it really is a remarkable place where we've gone from crank phones in my mom's generation to phones that we have essentially computers in. So they're coming faster and faster, and you're part of that. But it also means that your role as a healthcare provider will continue to change, and you'll have to change with the system if you want to stay with it. So we're going to take a quick time out. So you'll read this prompt, which is, what are 2 things based on globalization that will change by 2030? So going out, looking at some things on the internet, I'd like you to find 1 positive and 1 negative, and put that in a paragraph form on your Word document that you've created for this week. So what are 2 things based on globalization that will change by 2030? And obviously this is in reference to health or healthcare systems. So let's take a quick break. All right, welcome back. We're just going to continue on to prompt 2. We're going to talk about a little bit about consumer self-care trend. So trends are something that are developing or changing. As you can imagine, fashion is a trend, and systems that we have create trends and also fall victim to trends when they change. And so 3 of these big ones are self-reliance, personalization, and innovation. And self-reliance is around people taking care of their own selves. It's a very American model, and it's about being able to make decisions and having the right information to make those decisions. And then personalization is how do we help that information get back to the person so that it's not just, oh, you're in a general risk pool, but based on perhaps your genetics, you need to take some sort of medication. And then innovation is going to be mostly how do we interact with each other when we're talking about the self-care trend. So radical innovations really are there to enable consumers to help make those choices. If you think of a new tool at the consumer level, we can also anticipate changes in personal health. So those new tools, new choices, it can help us think about what do our patients want, or what do we want as patients, perhaps? I think we have that trend for that new consumer is all about lifestyle, and how does our health enhancements create the lifestyle that we want to have over a lot of years. So the idea of health is to have the best experience in life as long as we can. And so you might think about it from a beauty perspective, a health perspective, a fitness perspective, a sports perspective. You know, how do you want to live your life as long as you want to live your life? So one of the questions I have for you is prompt 2, and thinking about what people are actually able to deal with a lifestyle of health, in particular probably the poorest of our people. So why would some populations in the United States not see this trend playing out in their own life or community? So to explore that, we'd like you to list at least 5 social, economic, or cultural factors and why they would reduce the benefits that might come from technology or lifestyle innovation. For example, the cost of a smartphone device and the service you have to pay every month. That could limit the use of an exercise recording device like a Fitbit, or just make it not accessible. So what would be some other examples that you could see? And again, you're going to add this to your Word document that you're going to submit at the end of this lecture. So consumers do desire control. They're looking for real-time feedback and actionable information that is coming to them in a way that's understandable and that's going to connect them to things that are going to actually change their life. Again, people want to age well, and it's part of this be well trend. So we don't talk about 50 as being old anymore. Not that I'm 50 or getting close to it, but people are expecting longer lifetimes. They want a more active and healthy lifestyle. We think we can get there by looking at technology. And there was a report from 2005 that the National Science Foundation put together on the convergence of technology and the enhancement of human performance. It can sort of be described in this diagram. And so we're ultimately trying to enhance human performance. We're looking for the body to do better at aging, better at cognition, looking at it to do the work of the body just for a longer and in a healthier way. So there's information that's out there, and so we really need to harvest that information to help us make better decisions around healthy lifestyles. To that end, we don't control everything through the environment, because genes are a huge factor, and we're going to talk a little bit later about it. But genetic markers, genes that are modified, will ultimately enhance human performance. Might also do other things, but ultimately our goal is to enhance. We also need to be mindful, literally, of cognition and how neurons work. And we're really doing a lot more these days with what does the brain do and how does it impact growing old, how does it maintain health, and how do we train it or how do we utilize it to enhance our human performance. And swing around to the nanobiology, the nanotechnology. It's really going at this anatomical level of changing what is actually in our bodies, and whether that's natural or human-made. We're going to, enhance our bodies and our communities through nanotechnology in the future. So there are 3 current trends that you need to be aware of. One is predictive, where again we want to be able to identify risks and take preventative actions then to then promote health. And so you're going to see how the systems and different systems take on these roles of predictive prevention and health promotion. So the modern hospital is no longer bound in paper. It's maybe slave to some of its technology, but information technology is an integral part of healthcare these days. Whether you're actually in a hospital, you're in a physician's office, you're in a primary care office, you're in a school, lots of different places where health science and nurses and radiographers are. We are now struggling with what to do with that data. How is it useful for researchers? How is it helpful for the individual patient? Or how is it helpful for the care provider or the caretakers at home? So moving to e-health records costs a lot of money and needs to be maintained or improved regularly, which means more money. And that's based on the actual tools going out of date or new tools coming available, and then also how we use information. So this data is the beginning of systems to address the predictive. So it's through collecting information on a lot of people that we can see the trends, that there may be some dispositions genetically or environmentally to certain diseases. So we might be able to predict certain communities are at risk or certain populations are at risk for some sort of health ailment, from which then we can start to look at data that's been used to show prevention. So if we reduce certain things or we change biomarkers or we change exercise habits, we can actually prevent things. But that all is known through good data too. And ultimately, to make that public and health promotion activities requires technology. And so you'll see whether it's Altman or the Cleveland Clinic putting out apps that allow people to track their own health data, but see how it interplays with their environment and what things they can do to change their environment. And so lots of neat things that are out there that technology has to offer. Well, unfortunately, there's also a cost to this technology along with its benefits. So there's inefficiency in the different technology rules and how we connect between physician offices and the hospital to public health, perhaps. Quality is not always there. We don't always pull the right information. We might make the wrong decisions because we analyzed it wrong, so it leads to maybe medical errors. And we literally have poor healthcare IT systems, so not everybody's resourced as the Cleveland Clinic or even an Altman. So there's a lot of waste that goes into inefficient or ineffective technologies that we need to address. So prompt 3, we want you to either agree or disagree, and this is what we're asking. So is health IT, does it save money and significantly improve healthcare quality? So to do that, we want you to find 2 sources. Again, your book, the internet, a colleague, and summarize their position on the statement above. And then write your own opinion and how you came to it. So one of the things that we're going to drop a hint for you here is look at technology's role in prediction, prevention, and health promotion, since we just talked about it. That's going to help you focus in on what we're looking for in your homework. All right, so smart health, the ITU revolution. We are definitely in it. A couple of things from a future perspective. We want you to think about the digital transformation. Again, a trend is digital transformation. We're going from shaking hands to calling each other on the computer. We need to look at quality control. It is a huge issue within our organizations that accredit hospitals and physicians' offices. And so quality is quality is quality. And how to get there is going to be really led by IT in the future. But then we also have to, interestingly, deal with culture and how do different cultures interact with IT, both within the health system itself and then the health system interacting with individuals. A couple of examples might be around telemedicine. So as you're thinking, telemedicine, we are really talking about bringing together physicians, diagnostic services, patients, perhaps specialists, even things like counseling through the internet to people. And so when you go back to this idea of digital transformation, the trends of caregivers need to change. Where you might have gotten a half an hour to talk to somebody, now you're thinking they're going to interact with an app, and then you're going to use that information to ask more pointed questions in a faster fashion, perhaps. We have to understand the quality control within telemedicine and think about it as actual outcomes and start to measure that. Then we have to understand, are people willing and able to use telemedicine based on where they're at? I want to throw in this slide just because I thought it was funny. Education is also being transformed because that's part of the healthcare system, and we have to understand where this technology fits in, what kind of culture that means for us, and how it allows us to work with the trends that are out there in information technology. This information technology is going to be in our research area. We talk about the Human Genome Project. We're doing lots of things with genetics and how do we understand them and to document them, but then what do we do when we start splitting them and changing them, and what does that mean for future generations of cells and how they might actually be involved with the humans too. We also have robotic surgery. We're going to, from an IT perspective, and we're going to have things that are closed within an operating theater, or we're going to be doing these things maybe over multiple continents, perhaps. And so we're going to have to figure out how we work in them with technology. From a medical delivery platform, we are talking about the internet for the next generation. We're looking at the integration of communications between, actual healthcare professionals and within with the patients or clients that we're working with. We're doing everything from diagnostics to predictive analysis. We're going to be incorporating first responders and then security people for that communications. So that it's a really big, complicated process, which is probably not just or this model doesn't actually document well for us because it's so stinking big. But throughout your curriculum here at Altman College, you're going to be exposed to a lot of this. All right, so prompt 4, promises for increased access. Reach out to each other. Your parents even, or to the Apple Store or Google Store, whatever you might use. Find 2 popular media sources that demonstrate some efficacy for increasing access to healthcare through mobile technology. Want you to insert those hyperlinks into your document and then comment on the likelihood for these helping people who are not traditionally served or not currently served by healthcare. So again, don't think about the uber rich or the uber tech, but think about people who are missing from the healthcare system, who need extra benefits, and comment about their likelihood of using these media sources to their full extent. So running to the end, human enhancement. I think we all would like to be enhanced in some form or format, naturally or by technology or culturally. When we're thinking about enhancement, we might focus in on things like curing disabilities, or how do we live longer? How might we increase our intelligence? Maybe maintain our emotional control, or just are we beautiful aesthetically. And then ultimately, we hope that would lead to quality of life. As we put more and more information in technology, it's going to learn more and more about us as individuals. Not just our protected health information like our name, our age, our social security number, but it's actually going to understand our genes, or it's going to understand where we come from socially or culturally. This is a little scary for some people, and I hope it does scare you to some extent, because not only is it going to impact our current generation, but as we know what your genes look like and my genes look like, what would they look like if they were put together? And so we also need to understand that this impacts offspring. All right, so the Bionic Man, I don't know if you all remember that show. I'm sure it wasn't on when you were born. But there are lots of technology enhancements that currently exist. From improving people's eyes, replacing muscle tissue. There's things that replace bone. There's lots of interesting things that could be out there that we could imagine being used more frequently. Now again, regenerative medicine might not be the first thing that we go to, but think about what we're already doing around human enhancement for our athletes, whether that's drug or technology. It's crazy what money can buy, but we can also think about that as ultimately helping other people at some time too, if we can translate it and make the cost lower via healthcare systems. The trend, again, maybe we're using that word too much, but is to personalize medicine. When you think about the technology, think about the genetics. What can we do to personalize life? And longevity is going to be there. I remember the first mechanical heart that was put into somebody and how long they lasted, but the idea was to extend that person's life. What we can do now is incredible around different technologies we can put in the body, like pacemakers or automated external defibrillators, to deep brain stimulation that just happened in the clinic. So we can improve our longevity. But our ultimate longevity is around genomics, and how do we look at the future of the next generation? There are certain things like genotype, which is it's the organism, the genetic code in the cells, and it's sort of the genetic constitution of what makes the individual. It's not the entire individual and not solely responsible for the individual, but many of its traits. That's a little bit different than phenotype, which is the visible or expressed trait, like your hair color. The phenotype depends on the genotype that you have and is also influenced by environmental factors. This is important because our systems are going to be looking at the different components of these, whether it's genotype or phenotype, to help think about healthier, longer lives. So what are those things that make us probable or more likely for disease? Is that something that we can change from an algorithm to a nano pill of some sort, or do we need to change the environment? Do we ask people to change their lifestyle, quit smoking or exercise more? Or do we have special screenings for people based on some of their genetics? So both your genotype and your phenotype are important, and you're going to see again systems that deal with both of those, and how we have to probably do that more effectively in the future. So if you look at this graph and you think about the bottom being where disease just emerges and then to where it progresses to, which is usually death, we're digging deeper into the sources of our health. We're both environmentally and within our bodies. And ideally our goal would be to stop it before the symptoms appear. So how do we go below that dotted line that goes across through screening, predisposition testing, our genetic codes, those types of things. But ultimately, we're always going to have some sort of disease. We need to figure out how do we diagnose it as fast as we can, what kind of drugs or devices can intervene into slowing or stopping the symptoms and the actual disease, and then what can we do post-treatment to get people back to a healthy life. So, wrapping up the post-genomic medicine impact on consumers, we're looking for that predictability. We're empowering people as consumers. We want people to manage their lifestyle. We also want to manage, help our public health colleagues manage lifestyle. And it's going to change how medicine is viewed. We're going to be conquering disease at the atomic level in the future. We're going to have designer care. Little tiny actual machines going through our bodies at the cellular level or subcellular level, and this is our nano world, our nano medicine. You can think about these in terms of drugs for the future. Again, we're going to need global, cheap drugs that are out there. We want it to change. Perhaps in the biometric world, so what is measured and how do we change actual biological features. We're already doing this in agriculture, and when agriculture interacts with pharmaculture, and where we're designing drugs or natural remedies, it's going to be a big deal. We're also going to be looking at it from, is it accessible to us now? How do we make it accessible? How do we make it portable? How do we make it in enough volume for everybody? And so you're going to see different things like, if you can imagine, what would be the next generation of insulin pumps, where we've integrated pharmacology and devices and human beings and understanding lifestyles and how they exert energy and things like that. So that's where the drugs of the future are headed, we think. Then there's actually going in and turning off genes, perhaps. This might be before a child's born. This might be something that we can do when they're young. It might be something we have to do later. But what are the opportunities with that? And so there are synthetic opportunities for pharmaceuticals, nanoelectronics. Again, those are that subcellular machine that's going to go in and turn on and off genes, perhaps. Biomediation. So how do we insert other biological factors in to change pieces? And that all is around bioengineered materials and what they're going to be. Probably a combination of natural and mechanical pieces. So we can imagine the possibilities of the synthetic organisms, whether they're artificial or not. Not sure how that's all going to weigh out. But we can look at advanced biomaterials. We can think about artificial or enhanced tissues, or just-in-time pharmacology production for your particular disease because you're an individual person. So how do we do those? So nanobiology is meeting medicine. We're looking at designer drugs on demand, smart materials, devices, and maybe that's going to actually lead to a nano-enhanced immune system to be able to do that. So want to focus you in on our last prompt, prompt 5. So this sounds like cool technology, but what about population health? Well, you probably don't know about population health, so check out this YouTube video. You'll probably need to type it in by hand, and then, or it might be on the LMS. Actually, it's probably on the LMS. Then, how do you connect all this nanotech bio possibilities with population health? The example to give you is technology offers a democratization of health information, meaning I have equal access to it as you should. But because there's unjust educational attainment levels, there are several populations that are not able to even understand that health information. So you think about high school dropouts, people who live in in rural environments that might not have access to health literacy information. So that's an example. Write this prompt up, no more than a paragraph, but make sure that you offer some connection between these, positive or negative. All right, so just to summarize it, we're emerging into a new era of healthcare. Personalized, predictive, preventative. And if we can do that, we're probably going to do that through fast innovations. That's going to be our driver for health quality in the future. And then drugs of the future will be shaped by globalization. And then remember, globalization is that idea of ideas and tools and economies that are going to help us get there. So thank you very much for listening. Don't forget to turn in your assignment on the LMS, and then the other pieces that go along with this week, including posting on the discussion thread. All right, have a splendid day.